IHS uses the tribal recommendation and OMB, the Office of Management and Budget, HHS guidelines to submit a budget request, referred to as the HHS justification. And then July through September, after response from HHS, IHS along with HHS will submit a budget request to OMB, and that's the OMB justification. OMB will then provide a response, and IHS can accept or appeal. And OMB, the Office of Management and Budget, is under the Executive Office of the President. December through February, the decided upon budget submission is then used to develop the President's budget or the congressional justification, and that's submitted to Congress on the first Monday of February, or it's supposed to be anyway. From March to September, the House and Senate subcommittees hear testimony from IHS, tribal and urban stakeholders, and House and Senate appropriation committees work out a final appropriation bill to send to the President to sign by September 30th. If the bill is not signed by September 30th, a continuing resolution may be enacted. So that should help connect the budget formulation process to appropriations a bit. Here's some links on the current and prior year budget information. You can read the congressional justification as well as other documents for IHS and other departments under HHS. So now we're going to move on to area budget formulations. I mentioned earlier that there are 5 deliverables for the area budget formulations. The first is the national budget worksheet, the budget justification narrative, hot issues, area tribal representatives, and area report presentations. So the fiscal year 2022 is the budget year that we're working on currently, and let's see, here's a good timeline. So the budget meetings that are completed in December, the deliverables from those are sent to IHS headquarters in January, and then IHS sends a final roll-up of that information to the National Tribal Budget recommendation to area tribal representatives, IHS area budget team, and then the following month is when they're going to meet in Crystal City, Virginia for the National Tribal Budget Formulation Work Session. So the first deliverable for these for the area budget formulation meetings is the national budget worksheet. This is an Excel worksheet to enter the programs, the area programs increases by budget line item. Per the work group's decision at the evaluation and planning meeting this summer, the target funding level for this year is an additional 30% over the fiscal year 2021 National Tribal Budget Recommendation for a total recommendation of $11.9 billion. This worksheet's pre-filled with formulas and to indicate the target funding level, as well as informational columns with previous year's budget numbers. Its column and row headers are linked to other worksheets to provide explanation and definitions. Current service and binding obligation estimate numbers are included in the worksheet for informational purposes only. And the work group requests full funding for current services and binding obligations every year, meaning that the total will be added over the 30% program increase budget priorities. Negative numbers will skew results, so the work group advises against including them in your recommendation. And this is just for your information. You don't need to try to fill out the Excel sheet, but it is really interesting how everything fits together. So the second deliverable is the budget justification narrative. This document describes and supports the budget priorities that are reflected in the National Budget Worksheet. Some key points that should be included in these are how the recommended budget increases should be allocated, including any effects of the previous year's increases or some data that highlights those effects, as well as any linkage to the Indian Healthcare Improvement Act provisions where applicable, any linkage to GIPRA performance targets and outcomes, and how it links to the IHS strategic plan. And I've included a link in here for the where the strategic plan is located on the IHS website. So the third deliverable is hot issues. This is where each area has the opportunity to highlight any hot issues, regardless if related to funding, that are unique to their area. Hot issues are limited to 1 page per issue. There is no limit on the number of hot issues an area may submit. The format for those is to provide a brief description of the issue, include a background of historical information or data that explains the issue in more detail, and then also provide a recommendation, a budget recommendation, or provide an action that needs to be taken to address the issue. Hot issues that are submitted are included in the National Tribal Budget Formulation Testimony booklet that is presented to HHS in addition to the National Tribal Budget Recommendation. Here's some sample hot issues. NACUI included the following hot topics and requests in last year's national budget formulation, many of which were absent or not a focus in area presentations. So we discussed some of these earlier, the increased funding of the urban Indian line item to at least $116 million, ensuring grants can continue for Title V UIOs in case there's a switch to direct funding, implementation of unfunded Indian Healthcare Improvement Act provisions to ensure UIOs are held harmless from unrelated budget shortfalls and assessments, including 105L leases, including funds for Title V UIOs and funding initiatives, such as opioid funding and behavioral health funding, 100% FMAP for UIOs, funds for UIOs to modernize their health IT systems, and as well as suicide and substance use disorder among youth. So the fourth deliverable are the area tribal representatives. So we went over this earlier in the webinar, that there are 2 tribal representatives along with technical members that are chosen, and they have the authority to negotiate specific budget lines on behalf of the tribes in their area. And 1 representative must attend the evaluation and planning meeting, and there's also a technical support team that prepares these representatives by explaining materials and checking things for accuracy and providing more information. So the final deliverable is the area report presentation. This is a presentation that summarizes each area's budget priorities and hot issues. The work group decided that there will be no limit on the number of slides and that tribal organizations should provide input on budget recommendations at the area budget consultation sessions and not in separate presentations at the work session. There will be webinars held for each area to present their report to a larger audience before the National Tribal Budget Work Session. The time limit will be 15 minutes. The representatives will also have the opportunity to present during the National Tribal Budget Work Session. The time limit for that presentation is 5 minutes. And there's also optional template available to help when they're developing their presentations, including summaries of the service area, demographic information, funding and health priorities, hot topics, and success stories. And there's a link here where you can find the previous year's area reports on the IHS website. Oh no. So here I included a slide with a soundbite from Christina Francisco, who works in the IHS Office of Finance and Accounting, their division of budget formulation. And so this was, I'm disappointed it's not, didn't load. It's a really interesting soundbite from an October 21st, 2019 IHS call on budget formulation. So I asked, can you speak a bit about how representatives from urban Indian organizations participate in the area and national budget formulation? How can UIOs ensure their priorities are reflected at the national level? And to paraphrase, her response was that the work group had decided that UIOs should be participating in the area meetings, and so they preferred that the recommendations would get rolled up from the area to the national level instead of presenting at the national meeting itself. So, yes, this concerning statement makes it even more important to participate in the budget formulation process. So here we provided different links to help you get prepared for your area budget formulation meeting. So there's links to know the dates, to see previous year's presentations, to look at different year's budget recommendations on a national level, to view IHS's calendar, to see the congressional justifications, and as well as different information from the HHS website. So we're going to talk more about what some suggestions on what to share when you do attend these meetings. And so this slide has information from the Office of Urban Indian Health Programs data report. And unfortunately, this is the most recent. It's from calendar year 2017. But you're going to want to talk about the allocation of funds and the services, the treaty health services provided by Urban Indian Health Programs, or UIOs. You can talk about what your programs are doing, what they're doing in your area. Talking about the need is extremely important. Urban Indian Health Programs only get funding from one part of the IHS budget, one line item. The IHS added 6 new programs to the Title V budget line items due to the Indian Healthcare Improvement Act, with no funding increase to match what that program increase. And the payment or reimbursement for Urban Indian Health Programs differs from those of Indian Health Service and tribal facilities. UIOs do not get the all-inclusive rate, and some programs receive lower than $100 per encounter. urban programs have to pay for malpractice insurance. That's more money taken away from services for patients. All states did not expand Medicaid. And UIHPs need funding in order to compete with community health programs. Excuse me. And then make your request as well. It'd be great to for each area to have the urban line item on the top 5 priority list for each area, and then an increase to the urban line item. This dollar amount, $83,011,000, was the National Tribal Budget Formulation recommendation. I'm not sure if Francis is on the line or Julia. I'm not sure if that number is still accurate for our request. If either one of you are able to speak, I'm not sure if the settings are right for you too, but when we're presenting at an area meeting, it is important to have the participants, many tribal leaders that are there, to think of their family tribal members who live off reservation land and where they get health care and help, to make it personal. Some suggestions for sharing at your area budget formulation meeting. The first thing on this list is I suggest that you cite the Indian Healthcare Improvement Act. The citations at the very beginning of this presentation, they'll help you, and it is important to remind people that you have the absolute authority and right to be there. To provide a summary of service area and demographic information. If you can, if it's available, provide a map of the service area, share area health and demographic statistics if available, the population number, how many tribes are there, how many tribes does your facility service members on, how many ITU facilities are there in total, name all UIOs in your area, if there's any GIPRA performance information you'd like to share, state the number of UIO patients and visits as tribal relatives for users and patients, and treaty health services for visits. And that comes with an asterisk. Use treaty language only if it is uncontroversial in your area. I do know that that bringing up treaties is a sensitive area for many tribes where their treaties were not ratified. So if you know that that's the situation in your area, I'd recommend not stating that. But if you do have, if that's not the case in your area, I would recommend saying it, because it brings strength to what you're doing. You're going to want to highlight any expansion of services, patients, and growth that your facilities experience. You're going to want to state some of your financial needs and what your area would do with an increase. What are the needs of facilities in your urban area? Share some local feedback if you have some to share. It's really powerful about what patients have said, what you've heard. It's really a good idea to share what your patients have shared with you on how important your facility is. And then the final suggestion are for hot topics. Suggest hot topics local to your area that impact your urban population. The last thing I'd like for us to do is to share best practices and learn from the past experiences of others. I've included some questions on the slide to prompt the discussion. Please feel free to share during this time, and we can all learn from each other. So the first question on here, what tips do you have for fellow urban Indian health leaders who will be attending their first area budget formulation meeting?
Hi, this is Aaron from the Seattle Indian Health Board. Can you hear me?
Yes, hi Aaron. Thank you.
Hi. One of the easiest low-hanging fruit that you can get for a budget formulation is getting a tribe to deliver your ask for you. It's extremely powerful. A lot of the times when we're asking for them, depending on who's in the room and whatever your history is, some things just can't be mended. But usually, if you have a partner tribe, talk about the importance of supporting us. It goes a long way.
That's an excellent suggestion. That would be very powerful. That's great. Any other tips for first-time budget formulation attendees? Okay. So the second thing here is to please share any successes you have seen or experienced at an IHS budget formulation consultation confer.
This is Aaron again. One of the nice things to do is point out that we're going to get zeroed out in several of the areas. And because it works on an aggregate that they're averaging at the end, if you can get them to go above the 1% threshold as far as they can, it helps when they're actually putting together the national budget formulation before they present. So our area last year, I think, it was up at 144 million at its highest. Because they knew that we were going to get zeroed out or severely reduced in all the other areas. A couple of areas in particular tend to zero us out every year. So it's always nice to go see if your folks will go well above and beyond while putting our overall number up there.
Yeah, that's definitely a success. That's awesome. Thank you. Does anyone else have any successes they've seen or experienced? Okay, I know what you guys are waiting for. You're waiting for this question. Have you had a negative experience attempting to advocate for urban Indian health funding during the IHS budget formulation process? Please share your experience and let's identify opportunities to ensure history does not repeat. Oh, it looks like our director, Francis Crebier, is trying to speak on the line, having a bit of an issue. So is there anyone that might feel comfortable sharing a negative experience they've had trying to advocate for urban Indians during one of these budget formulation meetings? Well, until Francis can join in here, I'll share one that I know of. I'm not sure which year that was. I believe that was maybe 2017, 2016. I don't know. I think it's 2017 at the California area budget formulation. The funding for urban Indians was included, and it was a healthy, sizable amount. And by the time California area's request rolled up to national level, and there were presentations there, there was no information provided about urban Indian funding. The recommendations were just simply not shared. And so maybe you have some suggestions on how that can be prevented.
This is Aaron. Again, leaning on our partner tribes is a really big deal. So a lot of times we can go up there and talk about it. Unfortunately, no matter what we do, there is always a bit of a divide when we're talking about shared resources, even though ours is so small. So having a tribe present at the area and then find out who your area rep is going to be. So a couple of years ago, I was able to go at the time to be one of our advisors for our area, and that was really nice. So one, getting the tribes to back you, and two, getting an urban be appointed as an area advisor for the actual meeting really does help, because you are able to pass notes to your area speaker once they're talking about it. So for our area, it's Steve Kutz. For that, before Andy Watts, the speaker was Andy Joseph. So it's always nice to have that. But going back to some of the negative things that we experienced, some of the folks were a little bit sidetracked by asked for 2% last year, which I fully applaud. I mean, we need more money. But in the past, it had been, let's grow the entire pie and our portion of it. I just hope that we're working with the tribes a little bit more closely before we have increasing our portion going forward. I want a bigger portion. I think all of us do. We need it. We know we need it. But making sure that we have the tribes fully apprised before, during, and after will help.
That was really great. So keeping the tribes apprised of what your asks and what your needs are, I think that'll really help. So there's no, there's no, oh, that's surprising. I can't believe they asked for that, or that's what they need, or it alleviates any moments like that. And I really, really like your suggestion about being appointed as an advisor, being on that technical team. That would be really incredible if urban Indian organization leaders were a part of each area's team. That would be amazing.
Can anyone hear me?
Yes, we can hear you.
Oh
my God. Welcome.
So, thank you. This is Francis, and I see that Phoebe has written something, and I'm trying to look at it as well. Erin, have you been asked to be on your area's panel, or were you on that at all, or could you talk a little bit about how one could get on their area budget formulation committee?
Yeah, sure. So a couple of years ago, they honestly just asked, and I don't know how this goes with each of the different areas, but so I know our area reps really well, so we've established partnerships with all the folks who are the leaders of the area. So when they asked who's going to come along with us, we just volunteered. So this is actually, it's an expense to you. They're not going to pay for you to go over there to do that. But depending on who's going to be leading this and how supporting they are of the urbans to be at the table, when they asked for people to be a part of it, we had our normal folks who said yes to that. And then when I said it would be really nice if we could have the urban piece there, again, our tribe chimed in and said, well, I think it would be a good idea to have you there as an advisor with us. So although it was a bit of a volunteer, it was also a tribe asking for that placement. So again, I think advocating and planning with your tribes beforehand, so none of this is a surprise as you're going along, and then even potentially advocated for or brought up as a plan by the tribes, it really helps for the inclusion piece.
I think that's great, and I have definitely seen that work in different circumstances. So I echo what Aaron is saying about working with your local tribes if possible. And what I wanted to kind of just touch on a little bit in regards to when Aaron was saying that in other areas we're going to get zeroed out. So budget formulation is a lot of the numbers game, and so sometimes there's a lot of math involved, and some areas will do things like zero a lot of things out to kind of increase those priorities, and so in some areas we will get zeroed out, or we have been zeroed out in the past, and so the way that it ends up working is depending on how many priorities the agency allows to do that year, or there's a lot of technicalities in there. We need to get up to that average to say we need funding. So what NACUI has done in the past is, in being supportive throughout the tribal budget formulation process, is also using the tribal budget formulation numbers that are recommended for the urban programs, the final number in terms of the increase to ensure, since there's a whole year process in this, and so if anybody needs those documents or anything like that, we would be happy to give them to you. But I do think that having other folks advocate on our behalf is the best way, and then letting them know your issues. Sometimes we could probably feel like a broken record in terms of needs, but to some folks in the room, they've never heard that before. They don't know that programs don't get other line items. They don't know how much you all don't receive, and so it is important to just let folks know. And I've seen in some budget formulation in terms of successes, you just talk to a tribal leader for a few minutes and let them know kind of what's going on, and they might be really fully supportive of it and just didn't know about it. And so don't be afraid to let folks know the struggles and how they can help, because they do want to help. They just, they have a lot going on. So anything you can do to make that information easier, whether, it's a one-pager on your area or any kind of document. And I have seen some negative experiences. I don't know who was on the call a few weeks ago with IHS, but some of the negative experiences I've seen in the past is urbans not being allowed to be in the room or being kicked out of the room during budget formulation. And so one of the things that IHS has stated is that they are working hard on the rules and instructions to ensure that urbans are at the table in each of these area budget formulations, but it's important that we attend, and it's important that we are, able to speak up, because if we don't, no one will. And so in years past, we've been able to present nationally, but they're trying to make sure it's done at the area level, which is fantastic. But we're trying to make sure that folks aren't either kicked out. We've seen things get zeroed out between the area office to the national level, where, if the person wasn't there and they decide to zero out urbans or something like that. And so we really need to know. We're trying to provide technical assistance to IHS to ensure that urbans are at the table in every area budget formulation. And so if there's any other negative experiences that you can think of, whether you want to share it out loud or email it to us, it would be really helpful, because we are trying to make sure it's you all have a seat at the table for this, and that it's consistent across the board in the area offices, and we know sometimes it's not. So I wanted to just kind of put that out there. I've heard, great things and bad things, and so anything you all need in that respect, please let us know. This is definitely your opportunity to get an increase for the urban line item that can really help improve, the funding you get to your facilities to help our patients. So I just wanted to put that plug in there.
Thank you, Frances. So Phoebe from the Tucson Indian Center, she wanted to share that at the Tucson Indian Center, we have found that it is always best as an UIHP to have active, positive, respectful partnerships with the tribes throughout the year in serving our community. And because of these partnerships, the tribes become our allies in advocating for full funding at budget formulation. So thank you, Phoebe. It's another testament to having, developing and maintaining those relationships with people. I mean, deep down, most people want to help, and if they know what's going on, they want to do something about it. Because those are their people living in the cities too. Those are family members, cousins, and they want to do something to help, but they need to be informed too. So the final thing, I thought it would be helpful to do some hot topics brainstorming. What are current hot topics in your area?
Hi, this is Aaron. I'm sorry I keep on chiming in. I've got a couple of things
No,
that
please do. Please,
really working
please
on.
do, Aaron.
Yeah. So we're in the midst of a $46 million capital campaign, and we still have our unfunded Urban Indian Health Program infrastructure line item. We're not going to get any money in there. There's no way we'd hop in front of the tribe, and it would seriously piss off the tribe. But it's interesting to at least, as a top topic, to say that infrastructure for urban Indian health programs can be an issue that we can talk about together. I don't expect that it's going to happen in the IHS budget. I'd love to see it happen somewhere else like transportation and infrastructure, but it's good to have other folks talking about it and figuring out where we can fit in, because we should get infrastructure dollars. A lot of us are dealing with subpar facilities. For the longest time, we had duct tape in our dental department. We finally just revamped that through state dollars. But it'd be nice to start a conversation about how we can do these. I don't necessarily think it's here. It'd just be nice for a topic, but I don't think we should ask for dollars, because I wouldn't want to lose any of the momentum that we've gained with the tribes by asking for a new piece in the IHS budget. But I wouldn't mind it being a topic so people can start talking about it. And the other piece is, how do we address advance appropriations administratively? We're not going to get the dollars administratively, and we're not going to move appropriations to advance just yet, but is there an administrative function where we can recoup more of our annual contract dollars right from the get-go, rather than having to do it monthly or quarterly, however other folks are doing it? So there are two things that we've just been throwing around out here. So it'd be interesting to hear what other folks think of that.
Thank you. Yeah, infrastructure and advanced appropriations, I think will definitely spark some good discussions with tribal leaders in each area, because those are big ones.
And I thank you so much, Erin. We've been pushing, I know, for infrastructure dollars in general outside of this budget formulation too, in hopes to get you all some much needed funding for your facilities. And then as well, one of the trends that we'll have to keep in mind and figure out how to best communicate this is the trend of funding being 638'd, and the need for urbans to have kind of a set aside within that in the hopes that, you know, you all don't use your SDPI funding or opioid funding or any of these, you know, funding line items that are happening, to just consider the mechanisms for direct service tribes as well as urban Indian health facilities. I think is going to be key, as well as hopefully with the 105L, hopefully the line item will help not hit our inflation costs. But I know that that's been a big issue as well, hitting, you know, almost over $1 million in the last 2 years for the line item. So hopefully we'll see what, you know, how all that pans out in Congress, but that might be a topic we want to consider.
Yeah, that's a good one too, and I think a lot of tribes are going to bring that up and be very interested in chiming in on that. Can anyone think of some hot topics that are really specific to their area that might not be something that's on the radar nationally, but it's really important in their own area?
Karen, one of the things that we're looking more into is, I know that IHS has started to ask that everyone be tested for HIV and Hep C automatically. And I was just curious how that might be impacting, if there's any gaps in services, you know, with those, you know, I don't know if they're increasing funding to you all to implement that, or so I was just curious if there's anything you could talk to us about with that initiative.
No, I don't have anything on that. So we just started looking at what that means for our org. But I mean, they're asking, but they're not mandating. So I think.
Oh, they're asking. Okay.
The thing that it's the thing that we're looking at anyways, because we've been ramping up our HIV services. But I mean, I'm not the right person to ask for that in ops. So I would talk to Dr. Emily Ashbaugh and see if she's got anything that she could write up as far as what SIHB's plan is. Because we have increased our HIV services to our LGBTQ community tenfold these last 2 years. So, I mean, we have an internal plan to address HIV and HIV services anyways. So it's not like this piece is really pushing us in any direction that we're not prepared for. So as far as the ops aspect of that, I would have to get their input.
Okay. I think with that, with the goal to eliminate HIV and how IHS is operating that, I'd be interested in your all's how that policy is acting out in your communities. We know that it's important to have those services, but if IHS is helping you in any way in fronting those costs, and you know, obviously, what does that mean for all the services surrounding that? So. That might be something that you all want to consider, how that's impacting you all, and maybe that could be a potential hot topic on the national level for all the programs here on the call today.
Well, funding is always an issue, obviously. To kind of
right, of course.
with the cultural tone, because I feel all of us have the need to serve our community in the right way, and I know this has been a little bit of a hole in the past. So you know, unless you're really scrutinizing and designing your program specifically for the service, a lot of times you want to do it in the right way culturally, and you're not going to have any administrative support to do that unless you want to use your foreign $1 or any of your IHS contract dollars to implement that program. So it'd be nice if we had dedicated funds in the form of like a Ryan White type of thing. But you know, those don't necessarily exist at the level where we can create brand new programming, or at least culturally attuned programming right off the bat without administrative input.
Anyone else?
Well, thank you so much for sharing with us, those that that shared their experiences and suggested some different topics for the meetings. I think it's really important for urban Indian leaders to be able to speak openly and learn from their experiences. I think sometimes there's concern about if something would upset tribal leaders, or the talk about increasing funding, and I think it's really important for us to speak openly with each other. Well, my contact information is right here. You can contact me at sstevenson@mccooey.org. Are there any last questions? No. Okay. Well, thank you so much for joining us today, and thank you so much for your participation and your time. Thank you.
Thank you.